If you need medical care during flights, standard air services may not be enough. Non-emergency medical flights offer specialized care without the urgency of an emergency airlift. Keep watching to see how these flights work and how to arrange one. What is a non-emergency medical flight? So a non-emergency medical flight may be someone who has had an illness or an injury and they have since overcome it or have been treated appropriately, but they may not be stable enough to simply walk onto a commercial airliner to go back home on their own. In this case, we can either put them on a commercial medical escort with a flight nurse or flight paramedic, or we have the option of putting them onto an air ambulance with a simple team that will provide the necessary resources available to this patient that may not require critical care team. Non-emergency medical flights provide air transportation for patients that require medical supervision but aren't in stable condition. Who can benefit from a non-emergency medical flight? This answer is simple. This could be anybody who is stuck abroad who is just recovered from an illness or injury. This could also be someone that may require commercial medical escort, in the sense that sometimes a commercial medical escort, if clinically applicable, can be a lot more financially smarter for our patients. This can be anybody who is in stable condition. It can be an elderly individual. It could be a younger individual who has a condition that could be chronic that requires minimal medical treatments aside from what they're already doing long term. Or it could be someone who's probably post-surgery and they're stable. They just need additional eyes on them to make sure they get home safely. What are the types of non-emergency medical flights? The two biggest non-emergency medical flights that come to mind for me would be commercial medical escorts and then also air ambulance flights with a basic level team. Additionally, you have the ability to do commercial medical stretcher escort, in which if the airline permits it, the airline can actually book off X amount of rows and seats in the back of an aircraft, and they can stage an actual stretcher system where a patient can be safely stowed throughout the duration of a flight, and then have a medical personnel or medical team right next to them throughout the flight that allows them enough space to provide medical care in the event that they need something during the mission. Private medical jets, this can be a circumstance in which we had a charter jet in which we have an individual that's able to typically in these situations walk onto the jet accompanied by medical personnel, whether it be a flight nurse or a flight paramedic. Always an option, but it's extremely crucial that the patient is stable enough for it. Additionally, with charter jets, it is important that if they do require any type of oxygen or oxygen canisters, they need to make sure that the jet is actually hazmat approved, as we cannot just simply walk onto anybody's jet with oxygen canisters and bottles. How much does a non-emergency medical flight cost? Well, that's a pretty broad question, as this is always a case-by-case scenario. Some of the factors that come into the play for when it comes to cost of this is what is it that is required, such as, are we going to do a commercial medical escort for this patient, or are we going to do an air ambulance, or are we going to do a privately chartered jet? Also, it comes to distance, location of where the patient is at and where they're going, as there's things such as landing permits, there's fuel, there's immigration, there's those types of fees that we all need to make sure that everything is completely squared away before we do a mission, and that goes into the cost factor. Additionally, what type of medical resources are needed on board the aircraft? Although we say it's a non-emergent, there still is a differentiation between the team. They still may want a physician on board as a sense of comfort, or they may want some sort of specialized treatment that we may have to go above and beyond to get. And then the last piece is whether or not you do have some sort of coverage, whether it be a travel assistance coverage, an insurance coverage, or some sort of insurance that you purchased prior to this flight. As if you have that, it may cover the whole thing. If you do not have that, then we go down a different avenue. How do you arrange a non-emergency medical flight? This is actually extremely similar to arranging an emergency flight. It would be the same situation in which if you have the coverage, if you have the insurance, you're going through them initially to get through to us. Or if you're calling us directly as you know us, that's the other avenue. But in terms of the medical intake portion and the way that we do it, we treat it the exact same way as we do for our critical care transports, with starting with our nurse, getting the medical intakes, deeming the patient fit to fly, making sure that we have the correct crew and availability for it. And from an operations standpoint, making sure that we have a pilot crew that is available when they can go. Do we have the right aircraft? Or are we going to do commercial medical escort? It just all depends on the situation, but we do treat every single case as if it's a critical care transport. What are the key differences between emergency and non-emergency? So as a director of medical operations here, I treat everything as if it's critical, because you want to be prepared for the worst. Sometimes in medical, the patient who you deem very stable and nothing could happen actually seems to be the patient that may actually cause some issues. So the way that we train is that we are always prepared for the worst, which is why we carry pretty much the exact same equipment, supplies, inventory on every single mission. What is the difference between critical and non-urgent transport would be essentially we have patients who maybe, if they're non-emergent, they may be on some oxygen, they may not be. They may be able to walk onto the airplane actually, where vital signs are stable, not on any medications, any of that nature. They just need to get out of the situation in which they're at. Whereas if you have a critical care transport and emergent transport, you're dealing with someone who is in a critical state, someone who may be on a ventilator, someone who's being constantly monitored, having cardiac events. They are dependent on medical IV drips at the time or pressors to keep their blood pressure, their heart rate where it needs to be. Those are just some of the small examples of the difference between non-emergent and emergent. So some alternatives to a non-emergent flight depends geographically where you're at. When they're non-emergent, we have the ability to get creative. And when I say creative, that might mean a ground ambulance transport if it's applicable. Could also be like set a train, or it could be a boat. I have had circumstances where I have went into, a place like the Maldives where I transported someone on a boat out of a private island to the mainland. That was applicable for that transport. Maybe a private car service with enough space to get from point A to point B makes it, fiscally smarter. Just depends on the scenario, and it depends on the case, and it depends on what the patient can and cannot tolerate. At the end of the day, the most important thing is that whatever we do, the goal from a medical clinical standpoint is to not jeopardize the safety or the care of the patient.